think the one they've talked about is a colostomy. Colostomy.
Colostomy.
Have you heard this word before?
No. We've heard collectoral, which is what he came in for the appointment.
Colonoscopy.
He's had that. He's had an yeah.
What was the other word?
Colorectal.
Colorectal is
yes.
bowel surgery.
Yes.
Yeah.
That's
Colorectal
the other.
surgeon.
Yeah.
Bowel surgery. So we call this where the bowel comes through the tummy a stoma or a colostomy.
Okay.
This word, stomy, okay, I get called a stoma nurse, is a Greek word for a mouth or an opening. The beginning part refers to where it comes from.
Okay.
The colo is the colon. So I'll explain.
But stomy is the bag that attaches to
the opening.
Oh, the opening of the stomach.
Yeah, so I'll explain. Okay. Have you seen this picture before?
Yeah, yes, you do.
Where is the problem?
Yeah.
Yeah. Okay. Here?
Yeah.
Yeah. Okay. So they're going to, I think they will try not open up, they will try and do a keyhole. Okay.
Yeah, it's down just over here.
Yeah, it's down the bottom here.
Yeah.
So I think they will try and do it keyhole.
Okay. So they're not going to cut open.
They may.
Okay.
Sometimes they do, sometimes they don't. Normally if they cut, it's this way.
Oh, is it? So how far would they start from?
I'm not the surgeon. I would say here.
From around here?
Yeah. But I think they
Because from where he had the bypass before, they've already cut him down. It won't be that high up.
Okay. But they may just go in with camera.
Okay.
So laparoscopic keyhole.
All right.
I don't know.
So keyhole is not cutting.
No.
They actually going in from the sides.
Okay. In the tummy.
Okay.
So cutting from there.
No, they don't know yet.
I don't know. I think they will try and not do that. I think they may try and do it keyhole.
Keyhole, not hold from here, hold from there, and work in between.
But I am not the surgeon.
No.
So it may be they have to open.
Oh, I see.
Okay. So you swallow food. It goes into your stomach. Can you see? Yeah. It then goes into your small bowel.
Yeah.
Or your ileum. Okay. When it gets to here, it's quite loose poo, like a porridge.
Okay.
Then it goes around this large bowel, and it's called the colon.
Okay. So यहाँ से जो है नीचे गुजरते हुए जब यहाँ पे आ जाता है तो वो लूज हो जाता है.
And you pass it from your bottom.
लूज हो जाता है फिर अपनी बॉटम से निकलता है.
Okay. Because the problem is here.
Yeah.
We need to divert it before the problem
starts.
Yeah.
Before the problem actually starts. Okay.
Yeah. So we're going to bring the bowel out here on the left side.
Okay.
Like this.
Okay.
So this part of the bowel remains. Okay. So they're going to take out the problem.
Right.
But they're going to divert it over here. Okay.
Okay, so they're going to cut out this part in between.
Yeah. So this bit of the bowel remains in the pelvis.
Okay.
You may still feel you want to go to the toilet from the bottom.
Okay.
This is normal.
Yep.
Okay. Because this part of bowel still produces mucus.
Okay.
And it may be you feel you want to go to the toilet. Normal. It may only be like a teaspoon.
Okay.
But the nerves and the muscles at your bottom are very strong to your brain. So if only a teaspoon, you can feel you want to go.
Okay.
Okay, and that will continue.
तो आप जब एक टीस्पून के हिसाब से आप कुछ भी लोगे तो शायद आपको जो है ऐसा महसूस होगा you will feel that you need to go to the toilet.
Yeah. We just sit in the toilet in the morning. Yeah, okay. Some people have no problem, some people every day, some people occasionally.
Some people
but
don't
it's
feel
important
it.
I tell you this because sometimes it can be more of a problem for some people.
Right.
Okay. Some people, because now you know if it is wind you want to pass or poo. You know. Your brain is connected to your bottom and the nerves and the muscles are very sensitive.
Right, yes.
These nerves and muscles remain.
Okay.
So they're still sensitive.
Okay.
Okay, and they still tell your brain you want to go to the toilet.
Okay.
Nothing has gone wrong. This is normal.
Okay.
Okay, first of all.
Because they told us that he won't have the feeling of wanting to go for a poo. It's just going to directly go into the bag.
Right.
But he will have the feeling of wanting to go for a wee.
He might have the feeling he wants to pass something here.
Okay.
But the poo is coming here.
Right.
Okay? So I'm not saying there's a lot, but it's important you know there might be that feeling and you may need to pass a little something.
Okay.
Because all of our bowel produces mucus.
Right.
To make everything go round.
Okay.
This bit will still be producing a bit of mucus.
Mucus
It
helps it.
Yeah, absolutely.
It's like-
Lubricate.
Lubricate, yeah.
Yeah. But we don't see it because we go to the toilet and it whooshes down the toilet.
Right, okay.
So I'm just telling you that, just in case. Because sometimes, many years ago, I meet people and they say, oh, no one told me I might still get a little bit from the bottom. Okay, so I always make sure I tell people that.
That feeling you will still
Normal.
get normal.
Yeah. If you pass blood, not normal, obviously.
Okay.
So here, when they bring the bowel onto the surface, it looks a bit like your tongue or the inside of your mouth. It's bright red.
Okay. The same color as your tongue.
Mm-hmm.
But when
It's
you
going to be
touch
from your
it-
left side.
Yeah, your left. When you touch it, it's not painful. No feeling, no nerves. Okay? So shall we take a look at what it looks like?
Yes, please.
Are you okay to look?
Yes, please. Give me.
Yeah?
हाँ बोलो yes करो.
Yeah.
Yeah? Like this.
Oh,
Okay. That's going to be the left side.
Left side.
So,
If I touch this, not painful. It doesn't heal over. It's a piece of bowel they bring through the tummy and they stitch. Yeah? These stitches dissolve and they fall out.
still up.
okay,
But
the
this
white
doesn't
bits
heal.
there, those are the stitches.
Yeah, sometimes they're white, sometimes they're black.
Okay.
Okay?
And in the middle as well.
Yeah.
Is that stitch in the middle?
No, that's just the
ये
bowel.
आपके ना यहाँ पे बन जाएगा.
That bit there.
इससे
So-
बाहर आएगी.
So,
टॉयलेट बाहर आएगा आपको यहाँ पे.
Fish,
फिर बैग लग जाएगा उसके ऊपर.
never.
okay. But here, you have no nerves or muscles.
Okay.
Like your bottom, you have no nerves or muscles.
So he won't have the feeling?
No. No feeling, no control.
Okay.
Okay.
इधर आपको
It
feeling नहीं
works when
होगी.
it wishes to work. This is why you wear a bag over.
Okay.
Okay?
तो यहाँ से जो है आपको जो गोश्त यहाँ से निकला होगा, ओपनिंग जो होगी, उसमें आपको कोई फीलिंग नहीं होगी क्योंकि no pain.
You
No
might feel the bag is filling next to your tummy. Shall we look at the bag?
Yes, please.
Are you okay?
Yeah.
He's
Are you okay?
Yes, thank you.
He's strong.
If there is too much information
Yes, please. We want.
or you don't understand, just ask me to stop.
No, we'd rather have the full information.
Okay. This is very practical.
Oh yeah, all right.
Did you used to work?
British Rail,
What did you do?
many years ago on the
Truck on the truck.
on the tracks.
On the truck job, not truck.
Tracks.
Oh, busy.
Engineering.
But then he suffered a slip disc and he had to take
no.
early retirement in
Oh.
said 93.
So, after surgery, you need a see-through bag.
Okay.
Okay.
They told us that every time we're in hospital, he will need a see-through bag.
This is because we need to check the bowel is healthy
Okay.
and pink. Okay.
Pink.
Warm.
Oh.
Pink. It's the good color. This color.
Oh, okay.
We need to check it's got good blood supply. We need to look at it and check it's okay.
Oh, check that.
Yeah,
check the opening.
Yeah.
Okay.
So that's why we need it see-through.
Okay.
The hole is cut
Mm-hmm.
so it fits over this snugly.
Okay.
Okay. It may be this size. It may be this size. This size. I don't know.
Okay.
It depends on your bowel and the way they make it. Okay. They vary in size.
All right.
Sometimes they're round. Sometimes oval. They vary.
Okay.
Okay. We cut the hole so it fits snugly over the stoma.
Mm-hmm.
This is us. We will do this with you. Don't
Okay.
worry. Okay.
तो ये वाला जो है ना, ये वाला होल जो होगा ना, दूसरे साइड से जो है आपका भी यहाँ पे खुलेगा, जो इससे जो बाहर निकलेगा गोश्त का, उसके ऊपर जो है ये लोग फिट कर देंगे.
Still कर देंगे.
सील नहीं होगा, उसके ऊपर बिठा देंगे.
अच्छा it's joint.
जी
Okay.
it will sit on top.
Yeah, I'll show you, yeah. So this bag, you can empty at the bottom.
Okay, so it needs to be emptied. Can it not be replaced?
Yes. So, in hospital, when it starts to work, it tends to be more watery.
Okay.
So we have a draining bag. Are you okay?
Okay.
Yeah.
So हॉस्पिटल में जब होते हैं तो फिर ऐसा वाला बैग होता है जिसमें नीचे जो है ना ड्रेन करने का होता है। तो जब हॉस्पिटल में आप आओगे तो सारे सब कुछ चेक करने के लिए वो ऐसा वाला लगाएंगे ताकि आप वो ड्रेन होता जाए उसमें।
It goes 1, 2, 3 here. Okay? But if the poo, you okay? If it
Say
gets
potty, poo.
yeah. If it becomes very soft, which
Okay.
is what we are expecting, because it's similar to what you pass on your bottom,
Okay.
then you may not want to push out the bottom. It's not so nice to do this.
Yeah.
Then we would have a bag that does not empty and is
Okay.
not see-through. Okay? Some people with a colostomy keep to a draining bag
Okay.
because sometimes they might want to empty sometimes and sometimes not.
कुछ लोग जो है ये वाला बैग लगाते हैं क्योंकि कुछ लोग जो है वो खाली करना चाहते हैं उसको और कुछ लोग जो है पसंद नहीं करते हैं तो फिर वो ऐसा वाला लगाते हैं जिसमें नीचे वो नहीं होता है उसको रिप्लेस कर सकते हैं लेकिन हॉस्पिटल में ऑलवेज ऐसा वाला होगा जी।
There is not a right or wrong.
Okay.
Okay? Some people prefer to stay with the see-through bag, which is fine. Some people, this comes in this
Can I
colour.
have a look at
Yeah,
that
of
bag,
course.
please?
It comes in this colour, white, this stone, and black.
Like it.
Salt
Black, like underwear.
conference.
Yeah, black.
Yeah. I haven't got a black one, but it comes. This is the black one.
Oh yeah, that's it.
Okay.
Okay.
Thank you.
So this bag, when this sticks onto your tummy,
Okay. Around on when it goes
Yeah,
on top
goes
and
on
then
your
it
top.
sits. Yeah.
so
Yes.
if you
Oh. ये गिरेगा नहीं। खींचे?
Kicho?
खींचे?
Oh, it's
Yes.
okay,
I don't want to hurt you.
you're fine. You're
Okay.
fine.
So
I've
it's
got no
on the
hairs.
it's on no you've got skin.
Okay.
So it's got
So
it's on there quite solid.
generally speaking, so if you are going to change your bag, most people would change the bag maybe morning and evening.
Yes.
Sometimes maybe more, sometimes less.
Depending on you have to keep checking if it's
Yeah.
puffed out. I think is that way.
Normally when you get up and when you go to bed. Or if you're using a draining one, you may empty in between, okay? You have a spray to take the adhesive off. You spray,
Okay, so you spray it before you. It
Yeah.
helps to take
takes
it off.
the adhesive off.
Okay.
I told you a list of what to do, but
Adhesive
we'll
is a
teach you.
stickiness.
You take the adhesive off. You have a rubbish bag, like a nappy sack. So you would do this in your bathroom, okay? You can have the bag underneath.
oh, I see.
Okay.
You take the bag off, it's got the poo in.
Yep.
You put it in here, the same as you would a nappy. Can go in the normal bin,
Okay.
okay? You then have a cloth, just normal cloth we supply for you, and the same at home on prescription. Dry cloth, get the poo off the same as you would at your bottom. You would use tissue, yeah? Same as at home with your
Water
bottom,
and tissue.
yeah? Just dry first, get everything off.
Okay.
Wet, plain water, just plain water. Clean the poo off, dry, new bag. You tuck under in the right place.
Okay, and just
This
stick
is
it
what
on
we
around.
will teach you in hospital,
Mm.
okay? It is not difficult.
I see.
Up here, more difficult. How you are feeling. For most of our patients, they just want to get home. Yeah?
And
From
get on with life. We try to.
Absolutely. So they learn. most of the people don't like this and don't want it.
Mhm.
Maybe the same as you.
Yeah, because that's one of the things that's really a
But-
concern.
But they have little choice.
Mhm. We
You
understand that
Can
as
you
well.
understand what I'm saying?
Yeah.
Yeah? It is my job, but I know that no one ever wants to meet someone like me because it's very difficult.
Yes.
This is why we continue to support you, okay? All right?
Because I was telling Nurse Georgia that initially when we first came in, we was being told there's a 50% chance
I know.
that there's be a bag applied. Otherwise, we're going to try and attach the two pipes together.
Mhm.
So that's what we were led to believe until we came to the appointment with the surgeon, Dr. Mohammed, where he said that more than likely he's going to have a bag attached because he's had a bypass before. So our bag is going
It's
to
too
definitely,
risky.
it's definitely going to be attached. So it's
I know. Big leap.
everything seems to be happening really quick. Within 2 weeks ago, we only found out that he's got that bowel cancer spot, and then now we've already got the date for him to be operated on the
It's all-
17th.
In one
So
way,
it's happening really, really quick.
in one way, it's good it happens quick because you want to get rid of the cancer.
Yes, I
But
understand that.
sometimes your brain is, the emotion is somewhere back here.
Yeah, it
It's
hasn't
trying
even
to catch up.
acknowledged that this is actually, it's just happening too quick.
And for many people, they don't want to see us, but we like to try and see people because then you will recognise us.
I know, we
and-
definitely had to see you because we had to understand what it was that we
Are
was.
you understanding so far?
Yeah.
Okay.
If we understand, we can explain
Are
it
you
to him
okay
later.
for a little
Yeah,
bit
I'm
more
fine now.
information?
Yes,
Okay.
please.
Fine, I'm
Okay. So changing, you saw how it works.
fine.
Okay. If you want to, in here, you can try a bag on at home.
Yes, please.
Okay. These are for you to try on.
या आप घर पे ले जाके आप ट्राई करेंगे, लगा के
This
ट्राई
explains
करेंगे.
how to do this.
Yes, okay.
This is not the size of the stoma, but you can stick this on your tummy. It tells you exactly what to do. There's a little square. You can sit on your tummy first.
Oh, before you attach this.
Then you can put
Okay.
this on. Then in the bag, you can put some water in the bag, a little bit. And if you put these in the water, in the bag, put the
Okay.
water in the bag, then these in.
In that bag.
It will thicken.
Oh, inside the
more like
stoma
poo.
bag.
Yeah, yeah.
Inside the stoma bag. Okay.
So that shows you.
And what does that strip do again?
It thickens the water
Thickens
to
the
make
water.
it a little bit more like a poo.
Okay.
Just so you're not got a bag on.
Okay. And the red one there is to put, and is to is supposed to
stoma.
pretend the stoma.
But if you don't want to do this, no problem.
No, that's fine. Can I have a
This
closer
is
look
all for you.
at this,
And these
please?
are wipes.
Oh, okay.
But this is, the box is all for you.
Oh, brilliant. Okay. I just
The-
wanted to have a
It's
closer
fine.
look
The
at
closed
this.
peg, this is because when you're doing this, you don't want to be holding your clothes with this, so it's just
Oh,
to
right,
take them out of
okay.
the way. Or many people
जब
just
कपड़े
use
उठाते हैं ना,
underwear.
when you lift up your
Okay.
clothes, you clip so it doesn't
So
keep
it's
falling
quite
down.
practical. Okay.
Okay.
So, several other things. Right, eating and drinking.
Yes.
Okay. So with this stoma, you can really
Thank
eat.
you.
Thank you. What you were eating before. Okay. But at the start, you need to eat small meals. Okay, small. And you need to have a light diet.
Colostomy.
Okay.
Colostomy.
Colostomy. You need to have a light diet. So in hospital, you just have some Rice Krispies, some cornflakes, not too much fiber.
Okay.
You just go small. Okay.
So after the operation, थोड़ा थोड़ा को हल्का हल्का खिलाएंगे, दूध वाली चीज़ें, सीरियल वाली चीज़ें, ताकि slowly जो है food आस्ते आस्ते
Little
जाए
and
अंदर.
often. It is very important ongoing that you chew well.
चबाना ज़्यादा ज़रूरी है खाने को.
Okay. Are you vegetarian?
No.
What do you like?
Halal is there.
Okay, okay. So.
But he has changed his diet since he's found out about the operation. So it's strictly, as he was told, strictly fruit, veg, beetroot, and fish and chicken is what white meat is what was suggested. So
Okay.
that's what he's
So
changed
nothing
it to
gets
like to.
stuck.
No. So
Okay.
everything
Okay.
is
So
what's.
after the operation, continue with that, but then you can slowly introduce other foods.
Okay.
The reason you need to chew properly is because you cannot push like you can at your bottom.
Okay.
We don't want anything getting stuck.
Okay. तो आपको चबाना ज़रूरी है ताकि जैसे कि पुश करने की फीलिंग होती है, पुश करने की फीलिंग आपको नहीं होगी, तो आप नहीं चाहते यहाँ पे कुछ फंसे. So you have to chew it so it goes easily.
So things like skins, baked potato skin,
Big
Eat
potato को
potato,
जो
not the
स्किन जो
skin.
होता है,
not the skin,
स्किन उतार
because
के
it
किसी
doesn't
भी
break
चीज़
down.
की ना.
Okay. Nuts. Do you eat nuts?
Yes, he does.
Okay. Not at the start, please,
शुरू में कोई भी नट्स नहीं
because
खाना
they
है.
get blocked. If you like nuts, in a number of weeks you can have 1 or 2, but chew them well.
Make it
Not-
really, really small.
Not
Not a handful.
and
Yes.
swallow. No. It will block.
No, we always chew nuts because we obviously nuts.
Yeah.
You got to chew them.
Yeah, you have, but not everyone does.
Okay.
Or if
Okay.
you're
We
in
didn't
the
know
car,
that.
you do a bit of. But you need to chew well, okay?
No.
Like on a fruit or a vegetable, you have a skin. Likewise,
Mhm.
chew well. Do not have a whole punnet of grapes
Okay.
because the skin will all build up and get stuck.
So have,
So you can have a
most of the
few.
things without the skin is best.
Yeah, or you know, a few weeks down the line you can have some, but just in moderation.
Be
Yeah.
careful.
Okay, all right.
Yeah.
If the poo is going to be similar to what you pass in your bottom, so soft.
Okay.
You can get constipated. You can have diarrhea.
Okay.
The same as
तो
everyone.
कॉन्स्टिपेशन भी हो सकती है, शायद डायरिया भी हो सकता है, शायद शुरू में वो कैसा होगा.
Okay.
In the beginning you
The same
don't
as
know. You
everyone.
have to get used to the system.
Okay, so if your bowel has not worked for a day, you need to make sure you're drinking enough fluid.
So like during the operation,
Have a little
ऑपरेशन के
bit more
दौरान आपके
fruits
जब
or vegetables.
बॉडी जब हिलेगी नहीं, तो आपको जो है ना ऑपरेशन के बाद ज़्यादा पानी और सूप और फ्लूइड पीना है.
Okay, so it's a balance. Okay,
Yeah.
all right. Do you like fizzy drinks?
Yes, he does.
Okay.
And water. Fizzy drinks and water. Fizzy drink पीते हो ना आपको पेप्सी.
Fizzy drinks, not at the start. Then you
Diet
can have
Coke.
a small amount, but be careful because they will make it very windy
The gas from it. Okay.
and the bag will blow up.
Okay. तो fizzy drinks आपको मना है शुरू में
So,
क्योंकि उसमें
gradual.
गैस ज़्यादा होती है तो बैग ज़्यादा फूल जाएगा
It
तो
gives
आपको
you
लगेगा.
wind. Yeah,
Mhm.
the same as lots of fruits or vegetables. The bag will blow up with wind. There is a filter on the bag,
Okay.
but it will become saturated. It can only take so much.
Okay. What do you mean by saturated?
Not work anymore.
Okay.
Yeah. So the filter is here.
Okay.
So this lets the wind come out, but not the smell.
Okay.
But if there's lots of wind, it will only work for a while. Okay.
Okay.
So you need, if it's blowing up, you need to think about what you're eating sometimes.
Okay. तो ज़्यादा
This is why
ज़्यादा गैस
sometimes-
वाली चीज़ें नहीं खानी है.
Sometimes people like the draining bag as an option,
इस वजह से वो ड्रेनिंग
but
बैग
you don't have to
लगाते
use
हैं
it as a
ऑप्शन
draining
के.
bag. If it's, you can just take it off,
Yes.
but it gives you the option. So some people choose the draining
Mhm.
as an option. So if you were traveling, yeah, when you go home,
Mhm.
this is what you were asking about. I know Georgia, weren't you?
Yeah, he wants to
You
travel
might
to
want a
Pakistan.
draining bag because then, if you're on a journey, at least if you didn't want to change or you just need to empty, you
Mhm.
could do that easily.
Okay.
Okay, so don't always,
Alright.
think about that as well. Okay.
ड्रेनिंग वाला में ये होगा कि ड्रेनिंग वाला में जो है सी थ्रू होगा कि आप खुद आप देख सकोगे
Lots
कि
of
वो
people
कितना
have
भरा है
philosophies
कैसा
going
भरा
for
है
draining
आप
bags.
चेंज कर सकोगे.
Okay.
दूसरे वाले में आपको नज़र नहीं आएगा, आपको सिर्फ ऐसा अंदाज़ा लगाना होगा कि वो भर गया फिर आपको चेंज करना होगा.
Okay. This goes through a lot of what I've already gone through, okay? Talks
Okay.
about cutting the bags and everything, but don't worry too much. We'll work with you on that one.
You will
okay?
show us how to do
Shows
what.
us how to change the bag.
Okay.
Talks about the size.
Okay.
Which we talked about.
And the color.
Yeah, absolutely, yeah. And about it being healthy, because we're teaching you to become independent. This talks about returning from things. You can still go in the shower. Do you shower or bath?
Shower.
Shower. Shower's fine. Bath is fine.
He's got a stool where he has
Yeah.
to sit down on.
So
it.
the
He can't
bag,
stand.
if the bag is on, it will probably stick more because the warmth of the water will heat up. and make it stick.
पानी की गर्माहट से जो है वो ज़्यादा स्टिक रहेगा उस
It's
पे,
fine.
क्योंकि उस पे
If you want to take the bag off to have a shower, this is fine too.
then we
Okay.
use a spray.
Yeah, but it may work in your shower.
Okay.
The poo might come out. It's up to you. Either is fine. Okay. But you are not going to have water coming into you.
ओके सो शावर लेते वक्त जो है ना पानी बैग के अंदर नहीं आएगा, तो हो सकता है कि शावर लेते के दौरान आपकी पोटी निकले, क्योंकि आपको महसूस नहीं होगा, लेकिन बैग लगा
It's a
होना
one way.
बैग लगा होना ज़रूरी होता है,
बाल्टी के साथ नहाना होता है,
तो बैग लगा हुआ होगा उस पर, उसके साथ आपको नहाना है।
शावर नहीं लगाता।
शावर भी ले सकते हो आप, क्योंकि बैग के अंदर पानी नहीं जाएगा।
चलो
Most people have a shower, then change the bag after. The bag may get a little bit wet, but you can towel dry. It's
Okay,
fine.
but water doesn't go inside.
Water is not going to come inside,
Oh, I
it's
see.
going out.
ठीक है,
Poo is coming
मतलब
out.
गीला-
सो आफ्टर आप जब नहा लोगे उसके बाद आप उसको चेंज कर सकते हो बैग
So
को
if you
नहाने
sat
के
in the
बाद।
bath with no bag on,
Yeah, fair.
you're not going to fill with water.
ओके, तो अगर आप बात में बैग के बगैर बैठे हो तो फिर आपके जो है आपके अंदर पानी नहीं जाएगा आपके सिस्टम के अंदर।
Okay.
ठीक है, सो
People-
कैन यू हैव अ बाथ विदाउट द बैग?
He can, but it may work. Most people would leave the bag on.
ओके, तो अगर आप बैग के बगैर आप इस बात में
Otherwise, you may
जाओगे
have poo in your
तो
bath.
फिर हो सकता है कि बात लेते वक्त पोटी निकले, तो बैग लगा के आप बात में
Most
जाएंगे
people
तो
keep the bag
वो
on.
अच्छा बात
हाँ, या दैट्स फाइन, थैंक यू।
So people worry about infection
यस
because it's poo.
yes.
Yeah.
Plus, the climate is going to be going into, they have really, really hot temperatures, even in winter time.
Yeah. Okay.
And he's worried about
we
sticking.
very rarely see infections around stomas.
Okay.
What we tend to have problems with is if the hole is not cut correctly and the poo lays on the skin. This makes the skin sore.
Okay.
So we need to make sure it's the right size.
So it has to fit on there properly.
Absolutely, which is what we'll do with you. Sometimes you can have leaks from the bag. Normally it's the sizing, okay?
Okay.
And normally it's not maybe drying the skin or getting it right. Okay?
कभी कभी उसमें से लीक होता है, डिपेंड करता है कि वो जो है सही से उस पर बैठा नहीं है या कभी कभी वो सही से ड्राई नहीं हो रहा है, तो इस वजह से जो है
It's
वो।
normally the process. Sometimes we have to try a different type of bag,
Okay.
but that's us.
Okay.
Working with
So
you.
इनका काम है कि वो डिफरेंट बैग ट्राई करके जो ना देखेंगे कौन सा सही बैठता है उस पर, which one sits properly.
Yeah, which is comfortable. So that other problems that you can have, we talked about blockage.
Yes.
Yeah. We talked about diarrhea.
Yes.
Okay. We talked
Constipation.
about sore skin.
Yes.
Okay. Other things that you can have is you can have hernias.
Hernia. Okay.
know
What?
hernia?
Explain that in detail, please.
So, because they are making an opening here, are you okay?
Yeah.
Opening here.
They are making an opening here.
Left side पे
Okay.
opening
I
होगी
got
ना?
a hard note.
They are not. You got a hernia already.
Yeah, two, both
Okay.
sides.
Okay. Okay.
50 years ago.
Yeah. No, uncomfortable.
Oh, yeah.
50 years
I know.
ago.
50 years ago.
50
You
years
were
ago.
operated
Partly.
in Pali. Operated. Inguinal.
Yeah, both sides.
Inguinal. Right. Okay. So you know what it's like. Okay. So here, they're not sewing you back up because you have the bowel coming through.
Okay, it's an
It is
opening.
weaker. Yeah. Because the
Okay.
stoma is here, but it's weaker.
Okay.
So you can get hernias behind stomas. It is a problem.
Okay.
We
तो
see
हो
lots
सकता है
of
कि ओपनिंग के अंदर जो ना हर्निया शुरू हो सकता है.
Okay.
That is a common.
Yeah.
It's
Yeah.
a possibility.
Unfortunately, yes. We
Possibility
are
to have
involved
hernia
in
inside.
a national study across the country.
Okay.
We may ask your dad if he would be willing to be involved in it. It's because it is a problem and it's not being looked at properly.
Okay. So
Just the way the world
is there no way of avoiding
Right.
that?
Several things, okay, are important. Do you smoke?
No.
No.
No smoking. No drinking.
Do you cough?
No.
No. Okay. So, after the operation, yeah, if you are coughing, because sometimes you cough because you've had the tube down the mouth.
Okay. कभी कभी आपको खांसी आती है क्योंकि आपके गले में वो ट्यूब डालते हैं.
If you are coughing or sneezing or laughing, yeah, you need to hold your hand over here to support.
Okay. तो अगर आपको कभी छींक आ रही हो या आपको खांसी हो रही हो या आपको हंसी आ रही हो तो फिर आपको दोनों हाथों से जो है ना यहाँ पे पकड़ना ज़रूरी है।
And this is a good habit to get onto ongoing. This is
अभी
not
से आप
going to
इसको
stop.
प्रैक्टिस करना शुरू हो जाओ,
The
आदत बन
potential is
जाएगी।
always there.
Okay.
Okay.
You have to keep practicing this to make it a habit, a regular,
Okay.
so you do it without
We
even thinking.
say do not lift more than half a kettle.
Okay, so
No lifting.
आधी kettle जितना पानी भरा होता है ना,
Right.
half a kettle, only lift that much
No
weight, nothing
pulling,
heavier than that. उससे कोई भारी
Moving
नहीं,
furniture, no.
no
Okay.
furniture, nothing.
Okay. When you are sitting, you use these abdominal muscles.
Yes.
No. So when you're sitting, feet underneath,
Yep.
arms push.
Push up with your arms to stand up.
So you're not using this.
Yes.
When you are laying down in bed,
Mhm.
put your arm to sit yourself up. Use
Mhm.
the arms to push up. Sit to the edge of the bed, and then up. Not.
No, he can't do that anyway. He has
So
to
you have to
sit
be
up.
careful, okay?
आपको बैठना होगा, ऐसे ही
All of
अचानक
these-
नहीं उठ सकते।
Yeah. And I would also suggest we get you a support band
Okay.
to help,
बैग भी बैंड भी लगाएंगे सपोर्ट करने के लिए ना
which we
आपको।
will organise for you.
Oh,
Okay.
Okay, and you can wear. All of these things will not stop you from having a hernia, but they will help prevent.
Okay.
But it's no guarantee. Okay, I'm
Okay.
sorry, I have to tell you this.
Okay. So हर्निया के लिए ये जो है कुछ जो सहूलतें ये बता रही हैं उससे थोड़ी सी हेल्प हो जाएगी, लेकिन वो जो है हर्निया को रोक नहीं सकते। वो अगर हर्निया को होना होगा तो हर्निया हो जाएगा। So how do we maintain after the hernia if it occurs?
Right, if you develop a hernia, they can get quite big. Okay.
Okay.
And it's like
How?
a lump behind.
Okay. So we will notice.
Yeah, a raised area.
Okay.
Yeah, you would notice it. And we
Okay.
would.
But he'll be
Long
coming
term,
in for
we-
regular checkups.
It can be uncomfortable because it's heavy.
Right.
Okay. Normally, what we suggest is they tend to leave the hernias alone unless they're causing a problem.
Okay.
Okay. Because even if you operated on a hernia, it may return.
ओके। तो हर्निया जब होता है तो वो कोशिश करते हैं कि उसको डिस्टर्ब नहीं करें, क्योंकि हो सकता है कि उस ऑपरेट उस पर करेंगे तो अब दोबारा आ जाए।
There
So
is
they
no
try to
point in
leave
not
it
being
alone.
honest. Yeah. Okay. Sometimes the problems of hernias are that they are uncomfortable.
Okay.
Sometimes difficult to put the bag on if it's raised.
हर्निया से पता चलता है कि हर्निया जब हो रहा है तो फिर वो इनसाइड से ग्रो होगा, और वो जो what's this part called again?
Stoma.
The stoma,
Colostomy.
क्लोस्टोमी जो पार्ट होता है लाल वाला, ये सूजने लग जाएगा। It will start
But
to
we
swell
would
up.
help with this. Okay.
ये हमेशा हेल्प करेंगे।
Yeah. Okay.
They will help.
You can get the hernia twisting, strangulating. You've heard of this with the.
हर्निया को पहले कभी उन्होंने टाइट किया है उसको ख़त्म करने के लिए?
स्टील लगाया, वो
Yeah.
स्टील लगाई।
स्टील,
हाँ।
they said they've attached some type of steel
Mesh.
mesh.
Yeah. But you know, it doesn't happen very often. But
Okay.
we always warn people that if they start to feel vomiting, nausea, pain, anything like that, not me, don't phone me,
Yeah.
come into casualty.
Casualty, ये नहीं।
Always, yeah,
Oh.
always.
अगर कोई vomiting या just
same.
vomiting or
Yeah, nausea,
nausea or
vomiting,
dizziness
pain, any of these
or
things.
pain.
Yeah, okay. I am telling you the worst, but I have to. Okay, all right.
Okay. You have
Are
to
you okay?
let us
Yeah,
be
I'm okay,
prepared.
I'm okay.
आप समझ रहे हैं ना हम लोग जो समझा रहे हैं
But then
आपको?
you understand when we
आप भी
say
समझ रहे हो ना?
hold, do not be lifting. There is a reason behind all of this.
Yeah, no lifting, because
Okay.
where he lives at
No
the moment
shopping.
is that
No, no, no.
he's got to climb 5 sets of steps,
Oh wow.
and we've asked Nurse Georgia to send us letters which they've handed in to the council to
Yeah.
find him accommodation. We doesn't have to
right.
climb 5 sets of steps, because I'm sure
Yeah.
after the
So
operation,
not 5 steps, 5 flights.
5, yeah, 1,
Right.
2,
Oh,
3, 4,
lot.
5 before he gets to his flat.
Yeah,
So
yeah.
we've asked them to
Second floor.
provide accommodation for him
Yeah,
where he
worth a
doesn't
ask,
have
isn't
the.
it?
Otherwise, it's going to be recovery is going to be a major issue, and I'm sure the
Yeah.
stitches will open up as well.
I don't know.
But 5 sets of steps is it's.
Yeah, but whether they'll get that organised in time. Yeah, yeah.
So
But
we have-
maybe in the future. For
we
Yes,
applied to
yes,
council
we've
flat,
applied for it, so
ground floor.
hopefully
Oh, that's good.
So this is one of the things that is concerning for his sake of his recovery.
Yeah,
So
yeah.
we're trying our best to
Yeah, no,
get
good.
things sorted out
Well
before
done.
he leaves hospital,
Yeah.
because understandably he's not going to be able to stay in hospital for
No.
months and months, is he? He's
No.
going to,
Well, you won't want
you
to.
need.
You want to go home.
I understand, but
Yeah.
so
Psychologically, you
that's
want to
why
go home.
we need to.
So we have covered most things. There is one other thing I need to speak to you about. So position of where it is.
Yeah.
It will be before where your belly button and your hip bone. Somewhere in the middle.
ओके
Okay?
तो आपकी जो नाफ की जो ये जगह है, इसकी और आपकी जो हिप की जो हड्डी है, इसके बीच में होगा, नाफ और उसके हड्डी के बीच में.
On the day of the operation, we will see you that morning, okay?
Yes.
Either me or one of my colleagues.
Yes.
We know in the operation when you lay flat, your tummy looks different. Yeah?
जब आप लेटोगे तो
we
आपका
all have,
फैल जाता है ना, बॉडी जो होती है पेट.
we all have creases and folds.
Yes.
Okay, in our tummy, same as everyone. You wear trousers in the same place probably.
Yeah,
I think maybe
underneath
below
that.
your tummy.
Yeah, पेट के नीचे पहनते हैं ना
I'm not being
ट्राउजर को.
rude.
No, that's fine.
It's okay.
Fine.
Yeah, yeah. So it is important that where they bring this out is in a place that you can see to look after.
Okay, so it has to be
So-
above the trouser line.
Probably looking now, yeah.
Yeah. So बैग जो लगाएंगे तो आप.
So if it is under here, I wouldn't be able to see to look after it.
Yes.
I want it on a flat bit of tummy, not a crease, because it seals better.
So it has to come onto one of this part here.
Absolutely, a bit of
तो
tummy.
ये वाला जो हिस्सा जो होगा ना, जिस पे
So
अंदर वाला हिस्सा नहीं,
on
क्योंकि
the
आप जब
day,
पहनते हो ना, यहाँ पे से छुप जाएगा.
and not interfere with your trousers, because it doesn't matter, but it will be uncomfortable for you.
Okay.
So we get you, one of us, not the doctors, we do this, if you are okay with it, we get you to lay down and cough, and we check the muscle, so it's within the muscle wall to give the support.
Okay.
We're talking about the hernia and the support there.
Okay.
We then get you to sit up and twist round, relax, twist round. We're looking at your tummy.
So this is after the operation.
Before
the operation.
Before.
So operation से पहले आपके साथ ये होगी
One of
और
us.
सारी जो ये exercises बता रही है
We
अभी.
just get you to turn.
वो
We're looking
करवाएगी.
at your tummy, what happens normally.
Okay.
We get you to stand, we get you to see where your waistband is, and then we do, you and me or my colleague, we make X marks the spot
Okay.
where we think is the best place.
ये सही जगह ढूंढेंगे, डिपेंड करता है कि
And normally the surgeon will do it where we ask.
Okay.
Okay?
तो ये लोग डिसाइड कर देंगे कौन सी जगह पे, फिर उधर से सर्जन ऑपरेशन करेगा.
Is that okay?
तो ये सही
It's
से मालूम
important,
करेगी.
this one.
Yeah, okay.
Because we think this is permanent, it's important. Even if it wasn't permanent, we would want to have it in a good place.
Yes.
Okay?
Okay.
Now, the only other thing is, the plan is for this side.
On the left side.
Left side, yes.
It may be sensible, just in case, because I don't know, just in case something different happens on the day,
Not sure.
we may put a mark on this side,
On the
just
right
in case.
On the right
Okay.
side.
Yeah, just in case, when the surgeon gets in there, there's a problem. Rather than him then doing it in an awkward place. Okay, we may just go the other side just in case as well. But this will not encourage him, he will do this one.
Left side, it will always be left
But
side.
I'm just saying,
वो कह रहे हैं, हो
sometimes in
सकता है
these situations,
शायद हो सकता है कि राइट साइड पे भी जाए, लेकिन डेफिनेटली जो है वो लेफ्ट
Yeah,
साइड पे
yeah, yeah.
होगा.
sometimes they just ask us just in case, because we don't know. Okay,
Right.
but if you don't want that, that's fine.
Okay.
But sometimes it's better because your tummy, no one's tummy is the same both sides. Our tummies are different slightly.
Yeah,
The
दोनों
same
साइड
size.
से जो है एक जैसे नहीं होते, अलग अलग अलग
So
होते हैं.
sometimes it's good to make a mark just in case. Okay.
तो वो तो क्रॉस लगा देंगे ना, जिधर जिधर उनको लगता है कि कौन सी जगह पे सही है ऑपरेशन करना.
Okay. I apologize. I have given you a lot of information.
Thank you.
Oh,
Thank you for the
very much.
information. We
Okay.
appreciate that.
Is there anything any of you didn't understand or you would like to ask me?
How many bags and how would he go about obtaining
Okay.
and per
Okay.
day and
Okay. Oh, per day. Probably 2 or 3 a day.
2 or 3
Anything
bags
between 1 and
changes a
3.
day.
Yeah.
Okay.
But all of the bags are on prescription. You have a GP?
Yes.
They're all on prescription.